Good morning, Mrs. Thompson. My name is Sarah, and I'm one of the nurses looking after you here in the coronary care unit. How are you feeling this morning?
I'm still a bit tired, to be honest. My chest feels better than it did last night, but I'm very nervous about this procedure they mentioned, the angiogram. I don't really know what it involves.
I completely understand, Mrs. Thompson. It's perfectly normal to feel anxious, especially after what you went through last night. Why don't you tell me a bit about what's worrying you most?
Well, I've never had anything like this done before. I'm 79 years old. I worry something might go wrong. And they said something about putting a tube into my heart. That sounds terrifying.
Thank you for sharing that. It's very natural to feel that way. Let me take a few minutes to explain what the procedure involves and why your cardiologist has recommended it. That might help you feel a little more comfortable. Would that be all right?
Yes, please. I'd like to understand exactly what they're planning to do.
Of course, an angiogram is a special type of test that lets the doctors see the blood vessels in your heart in detail. It helps them check if there are any blockages or narrow areas that could be causing your symptoms or putting your heart at risk.
So it's like an x ray?
Exactly. It uses x rays and a special dye that shows up on the monitor so the doctors can see how well the blood is flowing through your coronary arteries. Before the procedure starts, you'll be given a mild sedative to help you relax. You'll stay awake, but you'll feel calm and comfortable.
And how do they get to the heart? Do they have to open me up?
No, nothing like that. The procedure is minimally invasive. The doctor will insert a very thin, flexible tube called a catheter, usually through a small puncture in your wrist or sometimes in your groin. From there, they gently guide it through the blood vessels until it reaches the heart.
That sounds awful. Will it hurt?
You might feel a little pressure or mild discomfort when the catheter goes in, but it shouldn't be painful. You'll have local anesthetic to numb the area, and the sedation will help you stay relaxed. Most patients say it's easier than they expected.
I see. And what happens once the catheter is inside?
Once it's in place, the doctor will inject a small amount of dye that makes your heart's arteries visible on the x ray images. They'll take a few pictures from different angles to see if there are any narrowings or blockages. The whole thing usually takes about 30 to 45 minutes, and you'll be monitored closely throughout.
All right. But what if something goes wrong? At my age, that's what worries me most.
I completely understand, Mrs. Thompson. Let me reassure you, complications from an angiogram are very rare. However, like any procedure, there are some risks we always explain so you're fully informed. A small number of people might have a reaction to the dye, such as a rash or mild nausea. Very rarely, more serious events like a stroke, cardiac arrest, or even death can occur, but these are extremely uncommon, especially with modern techniques and careful monitoring.
Those sound like serious things, though. Even if they're rare, it's frightening to think about.
I know it sounds worrying, and it's important you know the facts, but please keep in mind that the doctors who perform angiograms are highly experienced and will be monitoring your heart rhythm, blood pressure, and breathing every second. Most patients recover very quickly and can even go home the next day.
And this is the best way to find out what's going on with my heart.
Yes, it really is. The angiogram gives the cardiologist the clearest possible picture of your coronary arteries. It shows exactly where any blockage might be and how severe it is. That information helps the doctors decide on the best treatment, whether that's medication, a stent, or sometimes another procedure. Without it, they'd be relying mostly on guesswork.
I suppose that makes sense. I just feel like I need time to think it over. It's all happening so quickly.
That's perfectly understandable. You've had a big shock, being told you've had a mild heart attack, and now facing another procedure. It's normal to want some time to absorb everything.
I think I'd like to speak to another doctor or maybe get a second opinion before I go ahead. Is that okay?
Absolutely, Mrs. Thompson. You have every right to do that. No one will rush you into anything. I can let the cardiologist know you'd like to discuss it further or arrange for another opinion if you prefer. We want you to feel completely comfortable and confident in your decision.
Thank you, nurse. You've explained it so clearly. I feel calmer now that I know what's involved.
I'm really glad to hear that. Remember, you're in safe hands here. If you have any more questions or worries at any time, please let me or the doctor know. We're here to support you.
I appreciate that, thank you. I'll take a bit of time to think things over and talk with my daughter before deciding.
That sounds like a good plan, Mrs. Thompson. Take your time, and we'll make sure the cardiologist is aware. You're doing very well, and we'll keep monitoring you closely in the meantime.
Thank you, nurse. You've been very kind.
You're very welcome, Mrs. Thompson. Try to rest for now. We'll be right here if you need anything at all.